Hi everyone! I hope you're all doing well and are safe. Welcome back to the next episode of Cancer Behind the Scenes as presented by Cancer Together. In today's video, we'll be learning about chemotherapy. Here's just a short reminder. Make sure to check out the official Cancer Together website for any updated information on this series, to watch the YouTube videos when they drop, and to play the educational Kahoot game to help retain the information in a fun, interactive way. Before we get into any new content, let's just revisit the previous video and recap briefly. So before, as we mentioned, we've been talking about each form of treatment in their own exclusive videos, and in our last two, we've been talking about the different types of surgical treatment in cancer and how they're used for treatment, as well as different types of radiotherapy, what purposes each have, and dosaging limits. And now, we'll be moving on to our next treatment of discussion, chemotherapy. Let's talk about chemotherapy in the general aspect. To begin with, let's go a bit more in depth as to what chemotherapy, or chemo as is often referred to, strives to achieve. Now, we know that cancer cells grow and divide abnormally quick. In fact, it's one of its trademark features. In response to that, chemo works to stop or slow the growth rate of these cancer cells, and with this in mind, it's used for numerous things such as treating or curing cancer, lessening the chance of return, and easing the symptoms caused by tumors. Chemo treatment is received depending on a number of factors such as the type of cancer, if it's spread or metastasized, and where if it has, and if there are any other health concerns concerning the patient. It can be received as the only treatment for some, while in combination for others, depending on these factors. Now, while receiving chemo can help other treatments work better by killing cancer cells returning or spreading, in types such as neoadjuvant chemotherapy and adjuvant chemotherapy, chemotherapy treatment, like other treatments, does have its drawbacks due to killing or slowing the growth of healthy cells as a non-discriminant treatment. This will often result in symptoms that we often associate with cancer, such as fatigue, nausea, and hair loss, but these symptoms typically and often do go away after treatment has been completed. Now, before we begin with talking about the different types of chemotherapy there are, I just want to mention that chemo is often given through a thin needle placed in a vein on the hand or on the lower arm, whereafter a nurse is going to put it in at the start of treatment and remove it at the end, respectively. And now we'll be getting into the different types of treatment that fall under chemotherapy. So our first type is oral chemotherapy, which you can probably assume from the fact that it's called oral, comes in pills, capsules, or liquids that can easily be swallowed and taken through the mouth. Then we have intravenous or IV chemotherapy, which, as you can assume from the fact that it has that suffix in there that says vein, or that root called vein, it goes directly into a vein via a needle, catheter, port, pump, or a pump that can be internal or external in your body, and these are all just common equipments that are used in intravenous chemotherapy. So if you aren't familiar with any of these, other than probably a needle, that's absolutely understandable, and we have a visual later on in this, coming up soon after, that'll help you see what each of these parts are. Next, we have injections, which are given via a shot, you can probably tell, and these often go in the muscle, in the arm, hip, or under the skin in the fatty part of your arm, leg, or belly. Now there's intrathecal chemotherapy, which is also an injection, but it's specifically injected into the space between the different tissue layers covering the brain and the spinal cord in the body. Continuing on, our next type is intraperitoneal or IP chemotherapy, and this is directly situated in the peritoneal cavity. And if you're not sure what the peritoneal cavity is, it's the specific part of your body where there are a lot of our organs that are involved with like digestion, like the intestines, the stomach, or the liver. Our next type is intraarterial or IA chemotherapy, and this is directly injected into the artery that's leading to the cancer in the body. And then last but not least, our final type is topical chemotherapy, which, as you can assume from the fact that it's called topical, is only going to be on the surface of your body, which in this case, it's going to be a cream that's rubbed onto the skin for chemotherapy to be situated. And now for the visuals I spoke of a bit earlier. Now, this will have some of the basic medical equipment that's involved with chemotherapy used here, such as the needle, as you can see in this visual here, the catheter, the IV fluid bag, the syringe, and the ports are in the body, the pumps, and whatnot. So I'll just give you a second to look at this and just to see how the medical equipment is placed in the body for chemotherapy to work. And now moving on. So now we've covered the basic fundamentals to knowing chemo a bit more in depth in terms of purpose, types, and drawbacks. So the next question that comes, of course, is what's next? First off, when it comes to deciding which type to administer, the patient's doctor will decide on a couple of factors such as what type of cancer they have, how advanced it is, if the patient has had previous chemo sessions, or any other health issues or concerns that the patient has, and decide from there on. When it comes to the treatment itself, it can be given pretty much anywhere, such as a hospital, the patient's home, or the doctor's outpatient office, and how often chemo is received again is dependent on the type of cancer, how your body reacts to the type of chemotherapy given to it, or if it's done in cycles to give the body a chance to recover and build new healthy cells. Last but not least, our last topic is how can it affect you? And the answer again is that it depends, because there are a number of factors that matter, such as the type and dosing of chemo, the type of cancer the patient has, and how advanced it is, and so on. So an important note just to highlight here is that, contrary to some belief out there, doctors cannot tell if chemo is working based on the side effects necessarily. And that pretty much wraps up our video for today. Thank you for joining us for this video, and I hope it was informational and interesting for you all. Remember to play our educational game to review the information in an interactive way, and to keep an eye out for when the next video drops. Thank you all again, and have an amazing day.